To end our week of autism coverage, we're going to tell you about one group of very young children being classified on the autism spectrum at what some say is an alarming rate. We're talking about Somali children in Minneapolis. Their colorful shops line the streets, catering to their own culture and drawing in ours.
The Somali community came to Minnesota in 1993.
By that time, Somalia's political chaos had led to the killing or starvation of many of its people. For refugees, Minneapolis offered a place to start a new life, a new business, or a new family.
Many things attracted the Somalis to Minnesota to stay. Good health cover and good education.
Huda Farah works with the Department of Health on refugee resettlement. Through her work, she's noticed something troubling.
We're seeing an increased number in autism.
Did you have that back in Somalia?
Not many. Big boy!
The Minneapolis schools are seeing higher numbers too.
It's so glaring here in Minneapolis, I couldn't not see it.
Ann Harrington has been identifying kids on the autism spectrum in the Minneapolis School District for over 20 years.
We have seen a tremendous number of children that are Somali, but born here in the United States or in Minneapolis, who have autism.
Out of 100 children in the Minneapolis School's Early Childhood Special Education classroom program for autism, 25% of them are Somali. The district as a whole has only about 6% of students who speak or hear Somali language at home.
They are showing the more severe forms of autism, not the broad spectrum of autism that we see in our general population.
Shamake Osman is one of these kids.
I knew something wrong, but I didn't know what's wrong. I never heard anything about autistic or autism.
Shamake's mom said he would bang his head all the time. He wouldn't sleep. He couldn't talk.
They tested for school first, in school. Then after that, they said he had autism. And I never heard, and I said, what's the mean autism? What kind of sickness?
Hello, everybody.
Perhaps most troubling is that all of the Somali children the Minneapolis schools have identified with autism were born here, like Shamake. The district doesn't have a single child born in Somalia who immigrated here receiving special ed services for the disorder.
I believe it's vaccination.
In the rural Somalia, there's no immunizations.
Huda says parents worry not only about the vaccinations their kids receive, but about immunizations they themselves received before entering the United States.
When Somali parents come from the refugee camps, some of them get immunizations within those camps.
Huda says because of poor record keeping in the refugee camps, some Somalis receive the same vaccinations 3 and 4 times.
That's very worrisome. We need to find out what's going on.
In the U.S., the CDC says that research so far has shown no link between vaccinations and autism, but a number of studies are still underway. But doctors in Sweden are calling for research on another possible cause that could help Somalis here in Minnesota. Sweden has a high incidence rate of autism in its Somali children as well. Doctors there are wondering if for Somali people, a lack of sunlight in the winter, the widespread use of sunscreen, and efforts to avoid sun exposure are resulting in too little vitamin D being absorbed through their dark skin. They theorize lack of vitamin D, possibly in conjunction with genetic or environmental factors, could be a cause of autism and are calling for an official study.
I think it's something that is interesting and should be pursued through research.
Judy Punko is an epidemiologist for the Minnesota Department of Health. She says we're not set up to study the Swedish theory here.
We are attempting to develop a data system that will collect data that is reliable and valid so that we can identify cases and track them over time.
The health department is just in the beginning stages of setting up that system. But in response to the high Somali autism rates reported in Minneapolis, the health department has formed a small study group made up of school representatives, epidemiologists, and U of M medical experts to look at possible causes.
It's very concerning. It's astounding to hear the numbers are so large.
For now, the questions in this subset of our community continue.
At least every week, I heard about new family that have a child with autism. We need to really investigate and find out what's going on.
The trend of Somali children born in Minnesota with autism has striking similarities to a finding in the Middle East. Researchers there discovered that children of Ethiopian descent born in Israel had high rates of disorders on the autism spectrum. The same was not true for children born in Ethiopia who immigrated to Israel. Ethiopians and Somalis share a genetic tie. A forum is planned for more conversation on this topic in the near future, and it will be hosted by Ann Harrington and Huda Farah, who you saw in our story, and details will appear on our website when they're available.